Bulletin Prime. Thank you for staying with us. Health Cabinet Secretary James Macharia today appeared before the Parliamentary Committee on Health and affirmed that the new NHIF rates shall be implemented despite opposition. He said that the benefits that will accrue to all sectors of the Kenyan society far outweigh the criticism leveled against the system by various stakeholders.
What about the poorest of the poor? What have we done to support them? Government has put aside a separate program, Madam Chair, whereby we are actually topping up the cash transfer, which is done through Labour Ministry, the 2,000 per month. We are topping up with insurance to make sure that the poorest of the poor, the orphans, the disabled are taken care of.
I've even called the CEO and I asked him, where do you place the farmers? And he told me farmers are self-employed and so they are supposed to pay 500 shillings per month to NHIF.
I think the assumption is for these women groups is that none of them is employed. But we are aware that even in some of the women groups, you can find their local teachers who come from those areas, their nurses, and other people who are from that area. How do we separate that?
The category of those who are not actually working, people like the farmers, you know, completely destitute, who are voluntary, those ones, they pay 300. I am sorry if the communication from my department went otherwise, but this is something that can be rectified.
Right now, I can confirm they have been asked by NHIF Embu branch to pay 500 shillings.
We shall direct NHIF to issue a very clear statement and guideline repeatedly in the mass media to confirm and indicate the true position.
That the managed medical equipment kits that were unveiled at Machakos Level 5 Hospital in Machakos County by the President were actually meant for Malindi Hospital in Kilifi County, and further confirm whether Malindi Hospital has been granted Level 5 hospital status.
In a way, I think the honourable member was right. There was that intention to send the initial equipment to Malindi, but of course we could only do it with the concurrence of the governor. So the teams actually were sent to the county, but we could not start the works because the governor had not signed, had not assented to the project, but thereafter he has done so. So the only impact is possibly a bit of loss of time, because Malindi would have possibly been finished by end of June. Now I need to be by end of September.